Good afternoon, everyone. Welcome to our pledge ceremony for the first years that are doing pharmacy. I acknowledge all the parents that are here, all the lecturers, the staff members, and all the delegates that have been invited. I am sure they will all be given a proper welcoming. But for now, to kick off, I would like to welcome Dr. Dambuza.
Good afternoon, everyone. Seeing that the slides are not showing just yet, I will introduce myself. My name is Dr. Ntokozo Dambuza. I am a lecturer, a pharmacology lecturer in the Department of Pharmacy. And also I am the research stream coordinator. The rest of you don't have to worry about me for now. When you do your fourth year, then I'm going to be that fly that rings in your ears, you know, when we start talking research. I'm here to do a very exciting job. I'm here to welcome people. I grew up in a culture or in an era where guests or welcoming people was an exciting thing when we have visitors at home. Our homes had cabinets, like displays, where there are glasses and plates that are only taken out when there's guests in the house. So that is how much we welcomed people when we have whatever event at home. That blue and white plate and that gold cutlery, that's when we will see it coming out of the kist, because we know we have something exciting at home, we have visitors. So it's a moment like that. You know, we are going to have our pledge ceremony and all our first years are here, and I am so honored to welcome you. Unfortunately, I won't be serving food, so there's no gold cutlery and blue and white plates, but I just wanted to express how we feel, you know, to see all of you there. We also have few speakers lined up. I'd like to welcome them. We've got our DVC of Learning and Teaching. Is it DVC or Dean? Sometimes it seems like you're not sure which one is higher up, and so we've got Prof. Kiet, but she will be introduced properly by Dr. Katzira. She will come and introduce her properly. I'd just like to welcome you, Prof. It is such an honor. I know you are a very busy person to even accommodate us and be with us. It is such a huge honor. I'd like to welcome our lecturers that are involved with first years. We've got service modules, and I see we've got Megan, welcome. I'm trying to see other lecturers. If I don't mention your name, colleagues, yeah, you know, the eyes have crossed over the fourth floor, so they don't really work properly. So I see there's others that are sitting at the back. We welcome you today. And then the most important people, the people that run the Department of Pharmacy, the staff members, not only just the academic, but also the technical staff members and the administrative staff. Thank you so much, colleagues. You are welcomed, and I know you could be somewhere doing very important admin work, but you took time and you came to us and you came to support the pledge ceremony for the first years. And at this point, I'm going to welcome Dr. Katzira to come to the front to give a proper introduction on our keynote speaker for the day. Thank you very much.
Good day, everybody. Are we happy or excited to be here? I'll try again. Good day, everybody. Okay, so our keynote speaker of the day is our Director of Faculty for Health Sciences, Learning and Teaching. Her name is Prof. Annalie Kiet. Prof. Annalie trained as a social worker at the University of Western Cape. She also did her postgraduate studies, her master's and her PhD in social work, where she specialized in employee well-being programs at the University of Pretoria. She spent almost 20 years in the industry practicing as a social worker. She was running her own practice at some point, managing different portfolios in employee well-being programs, and then she entered her academic field or career journey as from 2010. Since then, she has worked in several academic institutions. She has worked at Fort Hare University. She's also worked at Free State University, where she served as the head of social work department. And now she's currently working here with us. We are honored, where she is the associate professor at Nelson Mandela. Prof. Annalie authored 16 academic publications. She has supervised 11 postgraduate students. She has been involved in evaluating undergraduate and postgraduate curriculums nationally. That's quite impressive, as well as regionally. She has served also on the board of the South African Association of Schools of Social Work and the board of International Association of Schools of Social Work. Her primary research interest in areas of social marginalization, cultural trauma, and older people. Please welcome Prof. Kit. Thank you.
Good afternoon, everybody. As I was listening to my own biography, I thought maybe I should start cutting out the years, because with all those years you can calculate them and then you see how long I've been working. But something very interesting also happened this afternoon. I've been afforded the position of Dr. Moeng, our DVC Learning and Teaching, okay? And I've also been afforded the position of Dr. Pumeza Kotanayati, who is our Dean of Learning and Teaching in the university. I'm going to kind of leave that to them to hold on to their positions, because yeah, I'm part of the faculty, and now you see me as I am. Ladies and gentlemen, I have given, so you also see the age. I'm going to use these glasses, otherwise I can't really see quite clearly on what I have written here. Would it be terrible if I do this slightly like that, ne? Just for myself, okay. I have given this a title, okay? And the title here is that this journey is more than medicine. Your journey as a pharmacist at heart begins this year and especially also this moment. So I want to say, I heard people saying that you're very honored that I could give you the time. I was here last year as well, and I really do love being here. But I want to say, good afternoon, students, our future pharmacists, staff members, and distinguished guests. I think for me, it's really an honor to stand here before you. And as you've listened to my bio, you will see that I would be one of the few people in this room that is not in the pharmacy profession, okay? I like your white coats anyway, by the way, all right? I've always liked it, even when I was a student and looking at those pharmacy students. I think what we are doing here, standing here before you today, it is at the start of what I hope will be a really deeply meaningful, a very challenging, but also a transformative journey for each of our future pharmacists. I'd like to acknowledge, as we do, and we realize that we have not just landed on this earth. So I want to acknowledge the space, this land, on which we are gathering, and more especially as well, the people whose stories and histories forms the backdrop of our academic journey. Those are the people back home who worked so hard, our parents, our guardians, Everybody that's part of us worked so hard to get us here. But it's also the stories of those people around who our profession is built, okay? The communities that we are having. I do greet the academic staff, the support teams, and most importantly, I greet you, the first-year pharmacy students who have chosen to step into one of the most, and listen, I'm going to repeat that again, one of the most vital professions in our healthcare system. I want to speak to you today not just about pharmacy, but I want to also speak to you about purpose, people, and the power of this future profession of yours. Okay? I dare say that pharmacy is much, much more than the medication that you are working with and the prescriptions on which those medications are based. It is a people profession. It is a science profession, and it's also a service profession. Okay? It is a science profession, but it's a people profession, and it's a service profession. You know, maybe you have chosen pharmacy because you love chemistry and biology. I mean, clearly you guys must have been good in those subjects because you would not have even met the minimum requirements for this qualification. And I know the colleagues here often say when we're sitting in the big meetings, they say that they are so privileged that the students that they choose are even far higher than the minimum requirements. So we know you love those subjects, okay? And that might be why you have chosen pharmacy. But you know, it's also possible that you saw a need in your community. You know those long queues at the public clinics? The medicine shortages? Patients often waiting, and then the medication is not even available? Or patients who leave the pharmacy and not really understanding how the treatment is working. I remember a few years ago, you know, I had to run back to the pharmacy like 10 minutes before it closed. Because what happened? I didn't understand how to administer the new medication that the doctor has prescribed to my sick mother. And I was responsible for making sure that she gets the right medication at home at the right time, and I was so confused. So I ran into this pharmacy 10 minutes before they close. And I said to the same pharmacist who helped me who has dispensed the medication to me, I said, I don't know what I'm supposed to do. I'm trying to pack this medication. I'm so confused. The pharmacist took her time to explain to me and to write down those details. While in that pharmacy, they were still able to take care of everybody else who was waiting there for their medication. And in 10 minutes, she was able to clarify for me. And you will not know the relief that I walked out there from that pharmacy at that day. So like myself, perhaps you also have watched people close to you struggling with health issues, and you want to be part of that solution some way or another. But whatever your reasons are for choosing this discipline, I want to hold you to one of your truths. You are stepping into a profession that is saving lives. Okay? It's not just the doctor that saves lives. It's the pharmacists that save lives as well. The doctor will not be able to do what they do without knowing that the doctor and the nurse and all the other disciplines there, they won't be able to do what they do if they don't know they can trust the pharmacist and everybody that is in that pharmacy. So whatever your reasons were, you are doing this because you need to save lives. You know, colleagues, I'm going to call you colleagues because that's how we're going to start talking. We're going to talk about you as students, but start thinking of yourselves as colleagues as you look around you as well. We know that in South Africa we face a quadruplet burden of disease. HIV, we still struggle with that, tuberculosis, non-communicable diseases, and we have a lot of trauma-related injuries any of us who come from communities where there are many social issues, you will know that many of the issues that young people are exposed to are really trauma-related injuries that happens right in front of their eyes, and they either are direct victims or they are secondary victims to it. And you know what? Your voice and your knowledge is going to matter in all of that. So as a pharmacist, you might just be the first point of contact for someone that is sick. Okay? You might be the first person that they can go into. Think about yourself as a student. If you can't go to the doctor because you're not feeling well, where do you go to? You go to the pharmacy, né? And you tell them why you're not feeling well. And you may be the only health professional that they actually can trust. So you may be the one who prevent a dangerous drug interaction, who educate a diabetic patient, or catches and just find out that there's a prescription error here and I need to change course, and you save a life. Okay? So pharmacy really then is a blend of hard sciences and of human care. Now you've heard people saying that I'm from social work, né? So probably you wonder why the focus of the human care comes in so clearly there as well. Because we're all together, we're all in this together, in this faculty. So during your 4 years here, you will learn, oh gosh, and I'm not going to try to say all of these titles, just in case my colleagues here are going to say I say it incorrectly. Can I try that out? In my own research, pharmacology, medical chemistry, and then all the others, microbiology, and so much more, okay? And I know that you will spend hours in the lab, in lectures and simulations, and yes, you will have late nights in front of your textbooks. And colleagues, sorry, you really are going to have late nights in front of your textbooks, eh? Especially you pharmacy students. It's no other news we can give you. Because it's not an easy degree, it really isn't. And if you want to be successful, you do need to be committed and you need to be consistent. Okay? That's the thing. In this thing, you need to be committed and you need to be consistent. So while it's essentially a very clinical qualification, I want to ask you, don't lose sight of the person behind the prescription. Okay? Behind each one of those labels, each one of those barcodes, and each one of those sets of dosages, there's a child, there's a grandmother, and there's a person who might be very scared, who is hopeful, or is in pain, right? This is what you work with. You know, with the rise in misinformation and the dangerous misuse of medication, and I'm trust you will all know as well, I do that too. I go Google and I try to find out what is now good for this, etc., and so on. And that's not necessarily where the misinformation come in, but we know that the platforms that we have make that possible as well. As a pharmacist, you are becoming the guardians of the truth in a sea of uncertainty. In many communities, especially our rural or under-resourced ones, you are often the most accessible healthcare professional that people can see. So what do you need to do? You need to speak very clearly, you need to speak ethically, and you need to speak with compassion to those people who are using your services. Looks like I've got a lot of pages, ne? I did it big so that I can see it properly as well. Okay. So, with all that said, do know that you are often going to be tempted into cutting corners and all of those. You need to stand your ground, even if other people are not doing that, and even if other people are not standing their ground, okay? Because you need to uphold the highest standard of integrity, which is why you are here today, which is essentially why you're sitting here today and you're going to take the oath. Because trust is actually your biggest asset. People need to trust you. They need to know when they're sick and they're going to take medication that they can trust you. In our country, we have a unique context that will shape your practice. And I think we always have to remind ourselves about that. We are a country of contrast. We have state-of-the-art hospitals. We have clinics that are well-stocked. We have private pharmacies in our malls as we are going. And then we have our community pharmacies in our rural towns who often have to run on passion and commitment because the supply of medication and even the supply of human resources are not equal in our country. We know that, okay? We do have the world's largest public antiretroviral therapy programs, despite the fact that the funding cuts that we have from the US recently has forced us to change course a bit. And we are still fighting the ripple effects of COVID-19. We just had a quick conversation there about education and how, as students, we often still find that we struggle with the side effects thereof, okay? We are battling the rising levels of non-communicable diseases like diabetes, hypertension, and mental health conditions. While our population ages, which is a good thing, but our health systems are often strained due to the decreased public funding. So there's always these imbalances that we have to work with. So you will face the real-life complexities, okay? As much as we said to you earlier, this is not an easy qualification. You need to work hard and you need to be consistent and all of that. You're also going to face the real-world complexities as you go out, because the systems don't always work that well. And the patients who come will often come with more than one diagnosis, and you will work in communities with limited resources. But while you have all those challenges, you're also going to find all those pockets of resilience there. You will have people in your industry that you'll find that work long hours just to serve other people. You will find innovation in the oddest of places. We don't always need to find that kind of innovation in a pharmacy, maybe in the mall, maybe, I mean, it is there, but you will be surprised about the innovation that you will find in your mobile clinics, through digital systems and outreach programs out in the community. And most importantly, know that you will be part of a generation of health professionals who must reimagine the future. The future as we see it now is not necessarily the future as it's going to work in 10 years or in 20 years, okay? You're part of that group of people that need to reimagine the future and the health science future. We don't need pharmacists who only dispense. I know that's a big part of your work, right? But that's not your only function. We do need pharmacists who advocate for people, who take their time to educate people about how to use things. I just gave you the example of myself. By then, I was already Dr. Annelien Keert with a PhD, and a pharmacist needed to educate me on something I could not figure out at the time, and I was so anxious. So that's part of your role. We need pharmacists who is willing to do their research, and we need pharmacists who are willing to lead in our society. So over the next few years, just reminding you again, you will be stretched. You really will be stretched in this qualification. You will learn so many things about regulatory frameworks, medicine supply chain, and there was another word I couldn't figure out, and I'm going to just skip it, but also rational medicine use. Can I get this in the right? Pharmacovigilance, is that right? Pharmacovigilance. No, I had to try it, eh? I just didn't trust myself to say it properly. Okay. But there's a lot of things, and I'm mentioning some, but there's a lot of things that you're going to have to learn, so you're going to be stretched. So there will be a lot of pressure, and sometimes you're going to doubt yourself. Okay? You're going to doubt yourself. You're not alone. We've all doubted ourselves along the way, and sometimes we still do. But you're going to ask yourself, can I really do this? Okay? You will be challenged by the rigor of this degree, and you will wonder whether this was actually the right choice for you to make. But I can assure you that you've made the right choice, that you're here because you made the right choice. So I'm not sure whether the academics are going to agree with me in terms of this, but just take it this way. They say, there's this thing where they ask you, how do I eat an elephant, right? And they said, you can't eat an elephant, but you have to eat bite by bite by bite, small pieces, okay? So, take it one semester at a time. Tackle that one subject, that one module at a time. Do learn from your classmates. Trust and respect your lecturers. Because the whole qualification that I spoke about that is very challenging also has built into itself a lot of support systems, okay? Make use of it. Communicate with your lecturers. If there are SI sessions that are attached to a module, it's normally because there's a recognition that that is a complicated module. Make use of it, okay, to break through it. Right? So this is the kind of thing that you need to be able to do and be prepared to do. Ask questions, stay curious, and stay consistent. I'm not that far from done, okay? But most importantly, do stay grounded in that the answer to the question as to why you decided you wanted to do this, okay? The reason why you started this journey in the first place. So when you get confused, when you feel a bit lost, ask yourself, why did I decide this? And use that to help you find your grounding again. Pharmacy is changing, and it's changing fast. We all know artificial intelligence is used in many ways. And one of the things you're going to find in your qualification and from your lecturers is how they are open to say, how do we use artificial intelligence ethically to help us work through this process and make it easier for ourselves. But you'll find it out there in your world as well, to points where you sometimes might ask yourself, are we still going to need a pharmacist, okay? If it can be used in terms of drug discovery, if it can be used in terms of pharmacogenomics, is it right? Genomics, okay. That often is tailored, in terms of people's DNA, etc., to figure it out. You can see some of your big words I'm still struggling with, but after all, I can forgive myself. I did not study this qualification, okay? But it doesn't matter how much the digital world enhance and how much AI might be brought into the pharmacy profession in what way. You will be irreplaceable. Because your compassion, your ability to question, that critical thinking that you're going to learn from in this qualification, your cultural sensitivity, your ability to communicate in the language that the person can understand, okay? To explain a side effect to somebody's grandmother, that cannot be replaced by anything. That is you. That's where you are as well, okay? So you are entering a profession with immense responsibilities, but also with a lot of possibility, okay? You can work in so many places, clinical pharmacy, community practice, in industry, in academia, like your lecturers here, regulatory affairs, you've got a regulatory body and you've got pharmacists working in there. Some of the people here are playing roles there as well. Policy development, or you can be an entrepreneur as well, okay? But you, most importantly, will help shape a South African healthcare system that is, and I'm going to want you to think about these words, you are responsible for shaping a healthcare system that is equitable, because it's not at the moment, that is inclusive and is responsive to the local needs of where you find yourself, okay? So I'm going to end off with this now. You are not really just studying pharmacy. You're not only studying pharmacy. What you are doing and representing with that white coat that you have there, you are training to become a custodian of health, a protector of the public trust, and a voice for evidence in an age of a lot of confusion. Okay? That's what you do. You are becoming part of something much bigger, a community of professionals that stand at the intersections of science and service. So if you thought the university is now big, and obviously this class is so much bigger than what I had in my undergrad, in school, okay, in basic education, you are still becoming something so much bigger. So this is not a coat of superiority. Okay? I can tell you, as a non-pharmacy student at a time, I looked at your coats. I saw that as superior, because you guys are clever, man, and we feel that you're much more clever than what we are, to be able to get through this degree. And yet, this is not a symbol of superiority. It reminds you of your responsibility, and that's what today is about. So wear this with humility. Wear it with pride, and above all, wear it in service of humanity. So welcome everybody to this profession. Welcome to your journey. It's going to be an amazing journey. And may you all rise to meet with courage, curiosity, and compassion in the world forward. If I meet any one of you in a pharmacy one day, right, I'm going to know, and I want to know, you are coming from Mandela University, because you are that pharmacist that is so human, that people feel so comfortable with you. Thank you.
Good afternoon, everybody, and again, welcome. I'm Mrs. Barry. I think you do know me. I'm the first-year liaison lecturer. I'm not lecturing you guys this year. I start lecturing you next year. Before I introduce the next speaker, I just want to add that I really love this ceremony because maybe because it fits in with my personality. Those of you that know me know I like to plan everything, and I like everything to be planned and to be tied. Where's Nelly? Everything must be tied up in a nice little box afterwards. So this is your first oath, but it's one of two that you're going to be doing. The next one, and I don't want to say too much, I don't want to take anything away from the next speaker, but the next one you'll say in front of your friends and your family and us as lecturers and your colleagues. The next one, you will be a graduate. So that's really exciting to me. It's a nice balance, and it finishes off. So let me not say any more, other than to introduce the next speaker. It's Dr. Mbali Levuno-Keeley. Dr. Levuno-Keeley is a senior lecturer in the pharmacy department. She's the pharmaceutics stream coordinator. She's also a previous HOD of the department, so she was the mommy in the department as well, I think up until the beginning of this year. And then she will also lecture you maybe in second year, but definitely in fourth year, and if you carry on and do a industrial coursework master's. Very exciting. Please welcome Dr. Levuno-Keeley.
Thank you, Mrs. Berry, for that intro. Good afternoon, ladies and gentlemen. I greet you all. Protocol observed. I see Prof. Kiet is gone, but in her absence, I do greet her. Colleagues from the department and also colleagues from the faculty, it's good to see you. Students, not first-year students who are assisting, thank you. And to our guests of honor this afternoon, BPharm 1 class. I think everybody that has stood here wears what I'm going to wear now. And without much further ado, I also put on my second pair of eyes. All right, so mine today is to take you through induction into the profession, which is a bit interesting because you're not quite professionals, you're still students. However, you are very soon about to get a scope of practice, which means you're professionals. So what I will do this afternoon is it'll straddle that. It'll straddle the student life, and it will also straddle the requirements that what will be required of you as a professional. Now, again, what I will say, you'll hear throughout the afternoon, there's repetition, there's a golden thread that runs through what we say to you. And what I say, you will have heard spelt or said a little differently by Prof. Keet. And that is that pharmacy is one of the most trusted professions in the world. It's also one of the most accessible. Most times, patients just walk into the pharmacy and they are able, without having made an appointment, to access world-class care and advice. Not only do they do that without making an appointment, most times they don't pay for that advice. But what they get is life-saving. Your chosen profession, which is pharmacy, touches many lives daily. We do that sometimes quietly behind the counter, confidentiality. So what I talk to with the person in front of me, the person behind has no business hearing that. We do that in manufacturing. So what is dispensed as pharmacists in the country, we have to make sure that that meets quality, safety, efficacy standards. We do that in research, researching these medicines, the use of the medicines, the cost, and a whole lot of things that are associated with that. Regardless of where you practice, your practice and your contribution is going to be significant. Now, pharmacy is a profession that is rooted in ethics. Simply said, what is ethics? It is doing what is right, especially when the right choice is not the most easy to make, it's not the most popular, and it's certainly not the most convenient, but you still go with what is right. As student pharmacists who are about to get a scope of practice, you're expected, amongst others, to respect human dignity, patient autonomy. So just because you are pharmacists, you're trained, you're pharmacist students, does not take the autonomy away from the patient. You're expected to practice with honesty, integrity, and confidentiality, which I just mentioned. You're supposed to uphold scientific rigor while being compassionate. So scientific profession, which is also a service profession. And never allow your personal gain to override patient welfare. So it is very important to take personal gain, put it aside, and advocate for that patient that is in front of you. Now, as students in health sciences, it is a privilege to be here. The number of applicants that the department gets is over 1,000. So you were selected from a huge pool of students. Meaning, yes, you did very, very well, but you also need to recognize that there's privilege to that. However, being a health sciences student, it comes with a lot of responsibilities, intellectual, emotional, ethical responsibilities. You'll get gray areas, which you need to navigate. You will be stretched, as Prof. Keet said. You will be required to think critically. You will need to have a lot of humility. Ubuntu, which is one of the university's foregrounding ethos, and you need to work ethically. So today, amongst other things, you will pledge to engage deeply with your studies, not just for exams, but you're going to do that to save lives. You will pledge to respect patients, communities, to uphold academic integrity, and most importantly, you are going to take the first formal step in a place like this, ceremony like this, sorry, I lost my words there for a second. In a ceremony like this, you will take that very first step into being a professional. Now, what is a pledge? A pledge is a formal statement or declaration that individuals make in a formal ceremony, affirming their commitment to uphold the values, ethics, responsibility, and standards of their profession, which is pharmacy. And those are the documents you've got in front of you. You're doing this wearing white dispensing jackets or lab coats, which are proxy in this instance. The white jackets were originally meant to symbolize and incorporate scientific principles in the practice of medicine. These days, the white jackets symbolize the following. 1, professional identity, that you're being trained as a healthcare professional. 2, purity and integrity, that's purity of purpose. So the reason that you are studying pharmacy, your intentions are pure. Cleanliness and hygiene, honesty and transparency. So when a person walks into whatever field that you're practicing, the fact that you're wearing this jacket, automatically it creates that bit of trust. You also, it represents accountability and responsibility, that is competence in the medicines and medicine safety, ethical conduct, you'll hear ethics coming through a lot, and readiness to serve with knowledge and compassion, ubuntu. It also symbolizes commitment to lifelong learning. So as pharmacy students, you're beginning your journey into the profession. It symbolizes your commitment to learning, to ethical growth, and clinical excellence as students, and also once you cross over into now being actually a pharmacist. Finally, it symbolizes unity across the profession. That is why you are wearing your white jackets, and we as the staff are wearing ours, meaning we all belong to the family, which is pharmacy. So, welcome to the profession of pharmacy. It's good to have you, and we know that by the time we're done with you, you will be able to practice as you should according to your scope of practice. Thank you.
All right, now that you have all been welcomed to the family, I would like to... Okay, it's fine, you didn't get it. It's okay. I'm going to call the next speaker, or the person who's going to be helping with the handing of the badges, okay? I'm just going to read the quick bio. I'm saying quick in literal terms, but it's quite a long bio for Dr. N.T. Kubashe. She's going to be helping with the name badges handing out. So Dr. Kubashe is a senior lecturer, also a former head of Department of Pharmacy. So she's a senior lecturer in the pharmacy practice stream. She serves on the faculty and university learning and teaching committee. She's also an official member of SAPC. How privileged are we? She's also a member of the PSSA, as well as an evaluator, a delegate in the accreditation, monitoring visit to skill development providers, offering learning programs for pharmacy support personnel, She also is an approved tutor, assessor, as well as moderator for the university and regulatory body, SAPC. She also is a member of the special task team for accreditation and monitoring of the BPharm program and standards. She also is a mentor for HES SA, as well as a university delegate and cohort representative at the Teaching Advancement at Universities. Okay, she also reviews for South African Pharmaceutical Journal. Ladies and gentlemen, would you please help me welcome Dr. Kupashe?
Thank you, Mr. Nkomo, for the introduction. Good afternoon to everyone. Good afternoon, ladies and gentlemen, and a special welcome and greetings to the parents that are here today and to the lecturers of the foundation modules. Mine is a simple task. I'm going to speak to the significance of the badge, or maybe the reason behind us issuing badges to our students this afternoon. I'm going to read it out because I want to stick to time so that we do not run out of time. In healthcare, badges, they normally denote a number of things and they are context specific. The types of badges that you will find in healthcare professionals is when a badge would display a healthcare professional's name, their title, the department they are coming from, for ease of identification by both their patients and colleagues. Number two, the name badges indicate healthcare's expertise, or maybe a pharmacist expertise or specialization. In our case, that would be us being pharmacists. In some cases, badges denote some or indicate the role the HCP enact. In our case, that will be us being pharmacists. Now, what is the significance of us wearing a badge? Ethically, I think Dr. Luvunogele has alluded to that. According to the Batubile principle, every patient has a right to be treated by a named professional. Therefore, a badge plays a vital role: pharmacist professional branding, patient safety, and trust in the profession. And also, it plays a vital role in pharmacist accountability, because wearing your name badge, it aids patients and other healthcare professionals in differentiating us from any other healthcare professional. So when people come to ask anything from us, they know that they are asking that question from a pharmacist. Therefore, that promotes clear communication between patients, between our colleagues, and other healthcare professionals. It also assures patients that they are receiving care from a qualified professional, enhancing the safety and the trust between a pharmacist, other healthcare professionals, and their patients, which is something my colleagues have alluded to as well. And this speaks to our core business, which is pharmaceutical care. Pharmaceutical care involves the patient being at the center of everything, and that us making sure that we provide optimal patient care. Wearing of a badge promotes accountability amongst us as pharmacists, encouraging us to maintain high standards of care and act within our scope of practice. This assists in streamlining the care and optimizing the healthcare workflow. And that is, to sum up, why we have to wear a name badge. I thank you.
Okay, from now, I will call the names for all your names in order, alphabetic order preferably, and then you can always come and get your badge and take your seat, okay? So I would like you to listen carefully to your name, and I would like to apologize in advance if I, by any chance, butcher your name. We can talk afterwards. Okay, the first one will be Owam Bantu. Okay, just to make this easy, can I just ask all the first year students to please stand and at least be close to the stairs, just to make it easy for everyone. You already know your surname, so if you are close to B, be ready. Bongwana Luto. Mandi Sabtelezi. Sianda Cebisa. Is Cebisa present? Okay. Kwetsi Chauke. Chauke. Glassen Shante. Glassen. Joshua Kotze. Joshua, are you in the house? Mosa Diamond. Akhona Dlamini. Nothando Dlomo, Sivet Tutumane, Fulani Qaqamba, Pilasande Kabatela, Zugo Gama, Nandipa Kumete, If your surname starts with H, please step to the front. Don't be right at the back. At least be somewhere close. Ovayo Kunya. Kamveli Hlekusha. Nelly Hadebe. Tando Hadebe. Asisipo Holweni. Apiwe Charlie. If your surname starts with J, please make sure you are right in front. Simamgele Jibilikele. Nkanyiso Giane. Yongama Chupele. Justice Kosa. Your surname starts with K. Please run to the front. Dineo Kosa. Kukuletu Kumalu. Apiwe Kwela. Skanyisile Kobeni. Sinesipho Kumkati. Spe Kunene. Landiso Quez. Deidra Laskai, Vivian Levac, Boitumelo Lefopane, Teshnika Lewis, Aphelele Madiba, okay, if you are M, you cannot be standing at the back. If your surname starts with M, please do not stand at the back. Mene Makakula, Mary Makoba, Mandisa Majoy, Avilema Landel, Keletso Malachi, Kathold Manaka, Moleho, yeah, that's the part I was talking about. Molebo Heng Mancho, Shelly Mapenda, Anita Makula, Pasega Masego, Anna Mashaba, Vutlari Masingi, Lusanda Mate, Michael Matumba, Anzani Mavunza, Thulasizwe Mazibuko, Viana Mbawate, Kutani Mbetsi, Zikhona Mdlazi, Siza Mgcotshelwa, Nqobile Mgilane, Ayanda Mkotuga, Hlalephilile Mkhwanazi, Noxolo Mkhwanazi, Sifundo Mkhwanazi, Yonwaba Mlindazwe, Nonjabulo Mncube, Khulekani Mntambi, Lusanda Mnyandu, Lebohang Makhoshoa, Kganeti Motlaka, Mohlakawe, Jabulo Motlong, Sinovuyo Mphakathi, Unakho Mtingi, Lisk Mugeri, Yandelo Mxabo, Zodwa Mzobe, Ray Ncube, Ray Ncube, Sesona Ndlazi, Philisiwe Ndletshana, Nothando Ndlovu, Azasakhe Ndongeni, Andisiwe Ndovela, Fulufelo Nethengwe, Siphephelo Ngobese, Ayabonga Njilo, Anathi Nkathana, Sikelela Nodladla, Thandazile Nogwanya, Sima Ntlula, Samukelo Ntombela, Liyabona Ntshebe, Liyabona Ntshele, Okuhle Ntshidi, Mayidunyawo, Luke Probert. Soneliso Qanda, George Ratselana, Ringano Rikotso, Tembinkosi Rosani, Ashley Shanik, Lehutso Sekome, Shabab Shabangu, Amanda Sbego, Vusiwe Sivisi, Zizile Sibiya, Vuyokazi Sinuka, Tlwanano Sithole, Charlie Sitiba, Asive Tangana, Asive Tangana, Nonofo Tatisi, Paida Moyo Tendai, Anga Chechana. Emihle Tembani. Retabile Tserere. Tserere rather. What a way to celebrate it. Nosizwe Shabangu, the birthday I'll never forget. Catherine Van S. Lusanda Vezi. Onga Vilakazi. Tumisa Vimba. Daniel Watson. Ati Zibayeni. Nobuhle Zindela. Simunye Zondi. Sifanele Zuma. Sibonelo Zungu. Nigiwe Zuzani. Is that everyone? Is there anyone that I didn't call? Okay. That was a task and a half.
Thank you very much. To all the students, can you please just double check and make sure that you have your name that is on your badge? You are not wearing anyone's badge so that you shift the blame to the next person. Thank you very much.
Okay, on to the next thing on the program. Now we are going to be taking the oath, the real reason why you are here. Remember the golden thread, what we've been hearing all over again. That means no plagiarism. This is the beginning. So when they are talking about you being ethical in what you're doing, it starts from now, not when you graduate. Mr. Masebe, I would like to invite you over so that you can help the students take their oath. Please give it to Mr. Masebe.
Good afternoon, everyone. I am Mr. Masebe, your mentor coordinator, that lecturer that always follows upon you if you bunk the mentor program. I'd like to ask you to please stand. How we are going to do it, I'm going to read one paragraph at a time, and then you please follow me up until the end of that paragraph, and then I'll read the second paragraph while you're quiet, and then after me, then you read another paragraph. All right. In the presence of friends, educators, and colleagues, I take this pledge as a pharmacy student within the Health Sciences faculty of Nelson Mandela University. I pledge to uphold the university and the faculty's values as I embark on developing myself into a professional in the service of society. In my pursuit to becoming an excellent healthcare professional, I promise to uphold the values embraced by Nelson Mandela University throughout my journey towards becoming the full version of myself. I promise to uphold the faculty's values of integrity, professionalism, excellence, accountability, social responsiveness, and resilient wellness. I will maintain the ethical standards of profession of pharmacy as the custodian of medicines and whose practice is underpinned by the principles of pharmaceutical care. As a health science student, I will do my best to understand and respect my academic and personal responsibilities, express my beliefs and views in a respectful and constructive manner, understand and respect my duty to serve others and the environment that I share with others. I will strive to be a reflective student, using every opportunity presented to me to develop in my profession without fail or misconduct. I will honor those who teach and mentor me, as well as those who guide my practical skill development. I will continuously embark on learning with gratitude and humility. In this, I will not be swayed by greed, prejudice, or selfish ego in the practice of my profession. I will respect my professional values and the communities within I learn and present myself with the integrity that is demonstrable for a pharmacy student. I will apply myself towards developing conscientiousness and sensitivity towards social justice and equality, and will strive towards internalizing a humanizing approach to those I work with. I will continue to pursue the same excellence in which I learn, and in honor, I will continue the pursuit of innovative, current, and relevant knowledge, and will share my knowledge with future colleagues and all who are in want or need of it. I will act with enduring respect for the dignity of human life. Foremost in my mind will be compassion, respect, and integrity, and an impartial care for my patients. I will hold sacred the trust of my patients and respect the information that they confide in me. Finally, I will do all in my power to help my patients reach physical, mental, and spiritual health, and I will strive for this balance in my own life. May I always have the courage and character to hold these principles sacred from this day forward as I place myself into the service of humankind. This oath I make solemnly, freely, and upon my honor. Ladies and gentlemen, round of applause to the students. You may all be seated. Thank you, Mr. Nkomo.
As we draw to the close, I would like to invite Prof. Bodenstein to give us the closing remarks. Please welcome Prof. Bodenstein.
Good afternoon, ladies and gentlemen. It's now my pleasure to thank the following people. First of all the BPharm 1 students for accepting responsibility and also for taking the pledge. And then also not to forget your parents, because behind each one of you, your parents are standing and they're also supporting you. Then I would like to thank the speakers, Prof. Keet for the keynote speech, Dr. Mbali Luvunokire for the induction, Dr. Kubashi for explaining the significance of the name badge. I would like to thank the presenters, Mr. Nkomo for being the MC, Dr. Dambuza for the welcoming, Dr. Katsijira for the keynote speaker introduction, Mrs. Barry for issuing the name badges, and also Mr. Masebe for leading the pledge. I would like to thank the following service module lecturers who are also involved with our first year students. They teach, for example, physiology, chemistry, so without them it would not have been possible, but we are grateful to them as well. The pharmacy staff, not only the academic staff, but also the support staff. And I think we would like to thank specifically Ms. Pumazela, who's been working hard behind the scenes to make this work. I think we can give her a round of applause. I would like to thank the mentors, Mr. Masebe and his team, led by Mr. Mabela, the organizers, Dr. Kubashi, and again, Ms. Pumazela, thank you. The AV media person, Mr. Mkegu, the photographer, Mr. Erasmus, and then also Mr. Holzer. The MC, Mr. Nkomo, and then also we shouldn't forget about the plants that we can see here. So the plants have been provided by the horticultural department and specifically Mrs. Nonzame and her team. And with that, I now declare the BPharm 1 pledge ceremony closed. Thank you.